morning, everyone. Today I'll be doing my presentation on lateral epicondylitis. The objectives for this presentation are to define lateral epicondylitis and its pathology, identify the causes and pathomechanics, identify the clinical manifestations and limitations, discuss appropriate tests and measures, differentiate between lateral epicondylitis and similar conditions, outline the rehab process, and review the expected outcomes. So what is lateral epicondylitis? Most of us know this condition as tennis elbow, and it's just a pathologic condition of the wrist extensors, more commonly of the extensor carpi radialis brevis. You're going to experience pain and inflammation in the tendons, and there's going to be microscopic tears in the tendons, as you can see in this picture. And this is just an overuse injury due to repetitive activities. There are 4 stages of lateral epicondylitis. The first stage is just associated with inflammation and having higher chances to resolve. The changes are reversible here, so it just has a better chance of healing on its own. Then stage 2 is going to be your pathologic alterations, for example, tendinosis. This is more of a fibroblastic and vascular response more than an inflammatory response, and your sports injuries are going to be associated with stage 2. Then stage 3 is going to be the pathologic changes and ruptures and structural failures, and then with stage 4, those are going to be your secondary changes such as fibrosis and calcifications. For pathomechanics, as I stated earlier, it's just going to be due to repetitive activity and activities that involve forceful supination and pronation, lifting heavy objects, repetitive grasping in sports like tennis, weightlifting, baseball, and softball. And the book also suggests that conditions like periostitis and bursitis can lead to or be the cause of lateral epicondylitis. For clinical manifestations, I listed the signs and symptoms. For signs, we have weak grip strength, swelling, bruising, difficulty with extension, decreased range of motion, and weak extensors and flexors of the elbow. And symptoms, you're going to have that pain, radiating, and sharpness on the lateral aspect of the elbow, and then it also has stiffness. For functional limitations, most of these are just going to be due to the pain. They're not going to want to do anything that's going to intensify the pain. So they're going to have difficulty carrying or lifting objects, inability to engage in sports, challenges with grasping objects, avoidance with repetitive motions, less productivity due to pain, and then avoidance is they're going to overcompensate on their contralateral limb. For tests and measures, you would use a dynamometer, the patient-rated tennis elbow evaluation questionnaire. For special tests, we have the Cousins test, the Mills test, the Moss's test, and then you would use palpation, x-ray, and ultrasound. For differential diagnosis, we have radial tunnel syndrome. This condition is just due to compression of the radial nerve, and they're going to have pain from their upper arm down to their wrist due to the compression. Then you have osteoarthritis, and then posterior interosseous nerve syndrome. Similar to radial tunnel syndrome, it's just going to be compression of that nerve, and they're going to have weakness or paralysis from the extensor of the fingers and thumb. Then you have cervical radiculopathy, myofascial pain syndrome, and fibromyalgia, which I went over last week. For the rehabilitation process, during the maximum protection phase, the main points are just going to be alleviating pain, joint mobility and soft tissue development, maintaining muscle function, and patient education. During the moderate protection phase, you want to focus on doing exercises to restore strength and function. You want to continue therapy to decrease pain, and also patient education too. Then with the minimal protection phase, you want to increase flexibility, reestablish proper movement at the radial ulnar joint, enhance muscle strength and function, and patient education once again. And then with this picture, this is just what you would use during the minimal protection phase. We have mobilization with movement. In A, you can see that the therapist is using a mobilization belt to do a lateral guide and active wrist extension. And then with B, they're performing the same thing, but the patient is squeezing a ball while he's performing the lateral glide. And then with C, we have just self-mobilization, and they're using a towel up against the wall. Then here are some more specific modalities and treatments. Shockwave therapy is used, that's what's in the picture on the right. This device, it just uses strong mechanical wave impulses to heal the injured tissues. Then we have ice massage, ultrasound, TENS unit, compression bandage, and taping, pain medications, and steroid injections. Potential outcomes with therapy is going to be decreased inflammation and pain, increased muscle function and range of motion, lower recurrence, increased grip strength, muscle recovery, and if there's not any improvement within 6 months of them doing therapy, then we would look into doing a surgical repair. And here's an overview of everything that was discussed. We went over the definition of pathology. We know that lateral epicondylitis is an overuse injury that causes pain of lateral elbow. It's due to repetitive wrist and forearm movements. Clinical manifestations and functional limitations. There's going to be pain and weakness with lifting and gripping items. We went over the special tests, range of motion, and imaging and manual muscle tests, differential diagnosis with radial tunnel syndrome, osteoarthritis, and MPS. And then with the rehab process and like the outcomes, we focus on alleviating the pain and restoring muscle function. And if therapy goes well, they should be able to recover with therapeutic interventions. These are my references. And are there any questions? No? Okay.
Who from your reading, who remembers or who can name special tests that we might do? Rule in and rule out. Cousins, okay. Okay. Yeah. Cousins, Maudsley's, Mills. For differential diagnosis, when you think of the special test that we might do that might look at something similar.
The poke.
The what?
Poke test. That's
Okay.
one that differentiates the medial and lateral.
Very good, very good. What are the two, there are two muscles that are very commonly involved in this. Anybody catch that?
The extensor carpi, radialis brevis. That was the main one.
Uh-huh. That's the workhorse, that's the powerhouse muscle there, we're using it all the time. And then there's one more that runs right alongside it that sometimes can be involved as well. What's that one? ECRB and, nobody said it, right? ECRL.